34-year-old female here with a Baker's cyst in her left knee. She has a medial meniscal tear, probably that's the cause of it. She is tender to touch in the medial joint line. She basically has pain with stairs and bending.
So here we're looking at this Baker's cyst. You can see essentially a large anechoic fluid collection underneath the medial gastrocnemius tendon, and a smaller part of this Baker's cyst superficial to the tendon. This is basically the opposite of what you usually see, where the larger lobe is superficial to the medial gastrocnemius tendon and muscle. Here it looks a little bit more sizable, that superficial lobe, but again, here you can see on the axial view that deep lobe is really the dominant lobe in this case. And you can appreciate how the medial gastrocnemius tendon is a boomerang shape. Baker's cyst is going between the semimembranosus tendon and the medial gastrocnemius tendon, confirming that it's a Baker's cyst. Here you can appreciate the popliteal artery. So here we're draining this Baker's cyst. I've decided to go for the dominant lobe, the deep lobe, though again it's a little bit more of a risky procedure as you're getting closer to the vasculature. But here we were able to get into it pretty easily and then drain it. The fluid actually was a little bit thicker than I normally see, so it's almost like a ganglionic collection of fluid. Sometimes that can happen with these cysts. And here we're just injecting cortisone where we drained the cyst, and essentially this is underneath the medial gastrocnemius muscle and tendon. Here you can see the outline of the cortisone underneath the medial gastrocnemius muscle.